This next tutorial is going to help us to import the digital file from the scanner. In a previous tutorial, I showed you how to introduce a new case into the Maestro Ortho Studio. And now there is another case coming in. Looking at the prescription, I recognize the business and I recognize the doctor, but it is a brand new patient that we're going to introduce. So I need to add a new patient to our library of patients. So, and the new patient is Johnny Depp. This may not be the Johnny Depp, but just another Johnny Depp. So we created the new patient, and now we're going to create a new label or a new record, clerical record, for this case coming through. Our business that we're going to do work for is Best Ortho. The doctor that we're doing this for is Dr. We had the Dr. A. Now another doctor is taking care of this, and this will be Dr. B that works for the same practice. The patient is Johnny Depp. We're going to add him to the label. So we just created a new label by selecting the data from the existing libraries. That will be our label. We'll go next. You may remember that this button right here is going to help us look for the .stl files. To no avail, because I know that this patient's digital file doesn't exist yet. This button here will let us look for .ortho files, the proprietary Maestro format. Well, also to no avail. That file does not exist in either one of those formats. Where we need to look for a new file is through here. This is our scanner button. By pressing the new acquisition button, the Maestro Ortho Studio opens the Maestro Easy Dental Scan software that is going to take us through the wizard of scanning the models together. Now, and what I'm going to do now is just minimize this screen a little bit so that we can see the camera output at the same time. So the instructions tell us to position into the scanner the two models together, and the lower model goes on the bottom. So I have the two models assembled together in what is presumably some kind of a construction relationship. It could be a centric relation, it could be some kind of advanced bite. If it is without the bite in place, it could be just a centric occlusion. And here we are, looking at those models. We're ready to scan, hit the button, and the scanning process will initiate. What the scanning process entails is this. The projector within the scanner is going to project white light lines onto the models, and those lines will bend as they trace over the topography of the models. The computer software will be able to capture and interpret what the camera sees. Now, this initial scan, which is called the MMR, as you can see on the screen right here, maxillary mandibular relationship. The only purpose of this scan is to capture the relationship between the two models. As you can see, with the models oriented as they are and being engaged into the pink white wafer, the camera does not have an opportunity to see a whole bunch of very relevant detail. It cannot see the occlusal surfaces of the teeth. It cannot see very far inside of the models. So once again, that is not consequential. We are only after the relationship between the upper and lower cast at this point. The models will go through 8 acquisitions in a process of being scanned. The models turn on a single axis rotating table. in 45-degree increments. And at 45 degrees, each new acquisition is being made, to a total of 8 acquisitions, which is more than adequate for any kind of work that we might want to do. Now, once the scanning proper of the MMR is done, the computer is going to do some post-processing and will advise us of the next step, which will be to remove the maxillary cast and the bite and allow the camera the unimpeded access to the lower model proper. Now, it is going to be somewhat important once we remove the maxillary model and the cast, not to disturb the three-dimensional orientation of the lower model relative to the camera. And I will explain why in a little bit. So here, the post-processing was done. I'm going to hold onto the models and remove the upper models and the bite. We are ready to press on. So now the scanning is going to be done for the lower model. During this scan, all of the anatomical details of the lower model are being captured. There is no bite to interfere with the view of the camera. There is no upper model sitting on top of the lower one to obscure the view. This time around, the cameras are going to capture every detail of that lower model. You may have noticed that there were portions of the model that were missing through a faulty impression taken, possibly, or maybe through some faulty pouring of the model. It may be easier to build up some of that missing detail in a clay-like material so that we don't need to worry about it once the scanning is done. That anatomy will be in place already, made up by us. Altogether, the scanning process of a set of models, including the MMR, the lower model, and the upper model, takes approximately 10 minutes. Now, obviously, as the scanning is being done, and this is the only case that I'm working on, there are some pretty pregnant pauses that are happening. Ordinarily, one can fill the empty time with other tasks that one can do. So now the scanning of the lower model is completed. Some post-processing is going to take place, and we are going to remove the lower model and replace it with the maxillary one. Now, it's important to notice that sometimes, because of the difficult anatomy of the models, the camera may have a difficulty seeing everything on the surface of the model. So when you have a cleft palate, or particularly difficult to see vault of the palate, we have an option available for either the upper or the lower model to add an additional auxiliary scan to the 8 scans that we're already doing. And that is what I'm going to demonstrate with this maxillary cast. And what I did is I just checked off the box for an additional auxiliary scan. I'm going to press on one more time. What this auxiliary scan will allow us to do is once the scanner goes through all of the 8 acquisitions that it normally goes through, we will be asked to reposition the model in a smart and a strategically thought out way to allow the camera to take a closer look at the areas that it may not have gotten a good look at as the model is going through its rotation on a turntable. It is going to be just a single shot that is going to augment what the camera is capturing now. We are nearing the end of the 8 acquisitions that are normal for the model scan. And now the wizard is suggesting that we take the model and reposition it in a strategic way for the camera to look into the difficult to see area. So in my case, I'm standing the model on end, letting the camera look into the pellet. And we're going to click next. Now the table is not turning. The cameras are just getting one parting shot into the difficult to see areas. And hopefully all of the detail will be captured between the 8 ordinary acquisitions and a supplementary one. So once again, a little bit of post-processing is taking place, and now I can remove the model from the scanner. The scanning is done, and I'm going to turn off the camera for now. So now we are at the step 4 of the 5 steps that we need to go through, and now we're going to go through alignment of the lower jaw. Because we were so deliberate in not moving the lower model, the camera's view of the model when it was being scanned independently, where all of the detail is, and the camera's view of that same lower model when it was in a relationship to the upper is the same relationship. so that we can easily just click through it and say next, find alignment, say yes. And what the computer does, through its sleight of hands, it takes the fully detailed lower model and slips it into this very same position on the MMR captured relationship. And we're going to say next. And now we are brought to alignment of the upper model into the MMR. We're going to go ahead. And this is where one needs to understand what is happening. When the upper model was being scanned individually, that upper model was being oriented with the teeth up. The orientation of that same upper model, while it was in a relationship with the lower, is the teeth down. So the computer cannot find the right way to relate these models. So what we're going to do is orient these models in a similar manner. So now my fully detailed upper model, which is this one, and that upper model in the MMR relationship are oriented reasonably the same. And I'm going to follow the instructions that are offered here and help the computer to orient the models correctly. I will do that by depressing the Shift button and double-clicking a spot on the MMR bite. And I usually choose the middle of the buccal aspect of the first permanent molar and the middle of the facial aspect on the gingiva of the canine. So now that gave me 2 reference points. And I will point to the same spots on this fully detailed model. I can then reorient the model and take a look at the opposite side and give the computer a couple of more hints as to how to properly orient these models. I can go and click at the first molar here. That's my 3rd reference point. And at the canine here, that's my 4th reference point. And the same thing here. First molar and a canine. Now, I offered enough information for the computer to crudely align the models according to the points. Now, my point placement is not 100% accurate, and this is just the ballpark alignment. But I will accept that, and I will allow the computer to proceed with the final alignment of the models, where now the software will superimpose the multitude of points, and this is the product. And I'm going to accept that. And as a result, we have an upper model that is available that we can import from the scanner, and we have the lower model that is also available that we can import. So we'll just click Next. And the 2 models will appear in a relationship on a screen in a moment as this processing takes place. So here are my models. I have a few extra views here once again that I'm going to turn off so that my view is not obscured. Now you will recognize the green and red and blue rings of the local origo corrective setup. So I'm going to make some adjustments. I'm going to pull this out a little bit so that I can see the green arrow better. I'm going to pull it up and pull it back in. So now I have all of the toggles, all of the handles available to me. I'm going to take a look at it from this perspective. Now, this is how the camera saw the models. You can see the occlusal plane is in reasonably good shape. The midlines are a little bit off. So I'm going to adjust that. I'm going to take a look at the underside view through the lower model, turn the lower model off, and make some adjustments. That takes care of the mid-sagittal plane. Now I can turn my models around and take a look at the occlusal plane. And it seems to be fairly much in line. It's a little bit too low, so I can grab the green handle and pull it up. What I'm looking for is the shadow line right there. So now looking at the view from the rear, I can also see if my occlusal plane touches the molars simultaneously, or if it's canted. So it looks like it's in a pretty decent shape, and I'm going to accept that orientation of the models. So here we are. The models were imported from the scanner. This is a relationship the models happen to be in by design. When they were initially scanned, they were scanned with a bite wafer in place, and now through some magic of sleight of hands, that bite was made to disappear, and all we have is the models in a relationship. Uh, Thank you for watching.